I'll be going over how to prevent knee pain and osteoarthritis. Our medical staff here at Storm Lake Medical consists of our nurse practitioner and our chiropractic physician, where we provide exercise therapy, the rehabilitation, weight loss, and pain management. But most importantly, we treat those common areas of pain such as back, neck, arthritis, nerve, joint, muscle, and of course, disc disease. As you can see, OA is a disease that occurs when the cartilage between the two bones break down within the joint. As the cartilage wears down, the bones increasingly rub together with each other, and eventually the cartilage may disappear completely, where the bones are unfortunately no longer protected from the stress of movement. OA can cause a lack of joint mobility, the stiffness, the swelling, and the pain, and overall weakness of the knee. OA is a slow process that develops over many years or even decades. It commonly develops after an injury to the joint or even over excessive use. This can affect people differently, so the rate of progression and the severity of symptoms vary. Some patients may require surgery to repair the cartilage surface or even total replacement of their joint. So, some of the common signs of OA are that stiffness of the knee, the crunching feeling, or the creaking sound of bone rubbing on bone. If you get instability and buckling in the knee, the loss of function, and pain around the knee in general, which actually can worsen and activity improves with rest. So, OA is also present at rest, but may awaken a patient from their sleep in severe cases of OA. OA is a common health problem affecting more than 20 million Americans. OA usually occurs most often as we age. So before the age 45, more men have OA than women. But after the age 45, more women have OA than men. Some people actually experience few effects, while others may be affected in different ways, such as restricted daily activities, the limitations at work, that personal and family life, the psychological effects, and even financial burden. So, as you ask yourself, what are the risk factors for developing OA of the knee? You have to consider the factors such as just aging, your gender, your heredity, the excess weight, if there was muscle weakness, previous injury, overuse, and even other illnesses. How is OA of the knee diagnosed? Well, that's based off your medical history, the physical examination, x ray, and even laboratory tests. Overall, our goals for our patients is to control the pain and the symptoms, to improve the motion and the movement, and also improve the strength and function of the joint itself. We want to prevent or even delay the knee replacement surgery, but most importantly, improve the patient's quality of life. Some of the treatment options for OA are the non-drug and drug therapies, surgery, intra-articular treatments, and even injections. Some non-pharmaceutical therapies consist of that health and behavior modification, the patient education, the physical occupation therapy, exercise, and even weight loss if overweight, braces, orthotics, and assistive devices. Corticosteroid injections are used to reduce short-term joint pain and inflammation. These injection treatments are limited number per year. The side effects include increased blood sugars, inflammation, allergies, and they can also become worse over time if repeated. Hyaluron therapy is used to relieve OA knee pain in patients who have not responded to the basic treatment programs. Hyaluronates naturally occur in substance of the synovial fluid. Some of the beneficial effects on the OA joints include the stimulation production of joint fluid, inhibiting the inflammation that can lead to pain and stiffness, inhibiting the cartilage breakdown, which blocks the pain receptors to directly relieve pain, and even prolongs the need for knee replacement surgery. Overall, this is important because it is the 6 to 12 months of pain relief and is an excellent safety profile. In a 6 to 8 week program with the one injection per week for the 5 weeks, including that exercise therapy and the rehabilitation program, this shows the 87% successful when following the program guidelines. It is critical and essential that halogen is intra-articular. Studies show that the fluoroscopic fluid injections bring in the results: 20% increase in effectiveness and less risk of articular damage from probing. Exercise therapy and rehabilitation has specifically designed exercises and a therapy program that has been shown to increase effectiveness by at least 20 to 25%. It is likely that your pain and symptoms could get worse. And we know if you had less pain and would feel better, you could do more. Our treatment is safe and effective and the smart thing to do to get on the road to recovery. So I urge you to schedule your consultation today with healthcare that cares.